They are expert in what? As dentist, long experience. First patient number one went to first room. There are four experts. Went to first room, then he asked the history, asked 10, let us formulate 10 questions. Each doctor will ask how many questions? 10 questions. When are you filling the pen? When the pen comes maximum? And when the pen comes, what you do? Since how many days the pen is starting? So many peculiar questions. That's called history of the patient. At the end of the day, he is an expert. He is a dentist. By virtue of his experience, immediately says, no, everything is fine, you take some antibiotic. Immediately he will start writing antibiotic. Go and take this thing after 3 days and then you report it. This fellow become, yes, I have to take antibiotic. This fellow again went to the second doctor. Let's say he allowed to go to the second doctor, examine him, ask the same 20 questions. Try to understand, this is a PhD problem. Yes, all the technique will come, but you are developing an expert system. You ask the same 20 questions to the same patient. And finally say nothing, you do gargling, salt water gargling, nothing is there, no question of medicine, and you will be alright. This fellow bichara went to the third fellow. The third fellow says, asks all the 20 questions. And this fellow says, no, I will come to my room, I will extract your teeth. That fellow, he went to the fourth fellow. All are experts in AIMS and Apollo and all these things. We go to the fourth fellow. The fourth fellow said, no, I have to do the filling. Come after resting, I will do the tooth filling. 4 prescriptions for the same patient. If there are 100 patients, everybody is out of 4 possibilities, they had different. But somebody found that you are a patient you want, that 2 or 3 fellows send the same prescription. So perhaps, instead of 4, if you say 5, maybe whatever said 2 people said the same thing, that tooth filling. Then patient number 1 is most likely to have, that is the prescription. Are you following me? Input condition is same question was asked. The second fellow was, 2 fellows told that teeth extraction. So second fellow, the real prescription is, you know the input, you know the output. For how many patients? 500 or 100 patients. This data is available. From a dental, go to the hospital, these histories are available. You can get the data. Go to AIMS, request or tell the help of a doctor, you will be good. Now you know the input condition. How many condition? 20 question. How many answer? 1. Either tooth extraction or this or this or that. Make a model. This model is an adaptive model, intelligent model. This model, 80% of our patients, 100 into 80 is how much? 0.8. 100 into 0.8 is 80. Randomly I will choose 80 people's data as the input. And I know for these 80 people, what is the desired signal or training signal or the teacher signal. What is the desired signal? Either antibiotic or tooth extraction. Let's say 0 to 0.25, only gargle. If the output is 0.25 to 0.5, then antibiotic. If the output is 0.5 to 0.75, you are filling. If it is 0.75 and above, tooth extraction. This is my classification. I tested everybody's data which is available. I trained my model. The parameter of my model is genetical growth. The parameters are chromosome. Are you following? And what is my minimization? The error square should 80% of the data I trained. My error square has fallen down. I am not going into detail, but the same data you can do in the laboratory. And the 20 people who are left, which has not been used for training, I pick up the 81 fellow, I brought him. And the doctor has told that it has to be filling. His history data I put, and his answer he is not telling. Only his patient came, I put my model, this question. My model will certainly tell that this fellow will go for tooth filling. The answer will be from 0.5 to 0.75 must. I go to the second fellow based on tooth extraction. And my model, his data, I don't know the answer. The answer is in his mind. I put this, his data which he told, the symptoms, the history, I put to the model. The model will give a value between 0.75. 99% my model will accurately predict. The genetic algorithm based expert system will predict this. This you can go for any disease, for anything. Hardly any. Then the doctor, I went to the All India Institute of Medical Science. One fellow, AIMS doctor is doing PhD with me. This problem. I went to the experts. The AIMS director begged. He said, Professor Panda, what are you saying? Then the doctor will not be there. All the engineer will rule the doctors. They will do the prescription. I said, no, sir. I told him. The answer was, please listen. I told, sir, assisted a metallurgy fellow. I assisted a mechanical fellow in UK who are doing the welding. I am a consultant of Tata Steel, where they are modeling the furnace. I am not a metallurgist. I am only assist you. Suppose you are disturbed today. Your son has failed in the class. You are disturbed. All the prescription today you do, sir, will be affected. You are mentally tired. Your prescription will affect. You are a human being after all. But my model will not do. My model will help you to guide you under disturbed condition. If I am putting my answer, then we tested about 500 cases. My model about 99% was for the expert version. I said, let your compounder, your technician run the program. Let him not tell you the result. Let the cheat the answer out of the 4 categories, you put it. You say the prescription, and I will show the prescription of all the patients you have shown today. You might be wrong. You reconsider. In this particular case, you have done wrong. My model is doing that. So it will help you to guide you, make a good prescription rather than criticizing. Then he said, okay, sir, salute. Then whenever I go, the director gives you a cup of coffee and you see. Question is, you have to learn. These are non-linear model, non-stationary model. And this model have a non-linear relation. How they are related, the input condition to the output, you cannot know. Only neural network, fuzzy, neurophagy, genetic algorithm can predict these types of phenomena, which will not do a mistake. Am I clear? Now let's go for, sir, खत्म हो गया सोचा क्या? Deep breath. Okay. आप जो मैं बोला ना 8 days I cannot